Hi, so Dr. Taylor, and today I want to talk about how foot problems can cause low back pain. The foot is a very intricate part of your body consisting of 26 bones and many joints that if these get out of alignment, that can create issues up above into the ankle, the knee, the hip, and even the lower back. So how does that happen? Well, there's many different joints here that we're looking at and bones that can get it misaligned. You have your talus, you have your calcaneus, you have the cuneiforms, the metatarsals, the cuboid, and even here in this joint here in this tibia, fibula, although the fibula is a non-weight bearing joint, if this gets out of alignment, this can create issues for you. I've seen it here in practice many times. And then that can affect the knee and hip and whatnot. So when somebody comes in our office, it's important that we evaluate the feet. Now, the thing is with back pain, you can have a problem with your back or your hip and you can have joints that are out of alignment in your feet, but you can have no symptoms at all. So you may not have any discomfort in your feet or know you have a problem there at all, but these joints get pretty stiff. So what you can do yourself is you can just take your shoe off and you can just kind of feel around here. If it feels really good to just kind of press on the bottom here, that's normal, but sometimes you hit a spot and that's tender. That's a sign that there's inflammation in there. So you can be pressing your feet in through here, just kind of working it out, feeling the bottom here. And if you find a spot, then that can be an issue here for you. So that's a real good telltale sign that you may have an issue going on here with your feet. So it's important that you wear really good supportive shoes. Your shoe should have a good little bend here towards the toes when you bend it. It shouldn't be caving right in the middle. Also, your shoe should, when you bend it and twist it like this, it should be somewhat firm. Thirdly, when you look at the bottom of the shoe, should be flat. And lastly, the telltale sign whether you have the right shoe or not is when you stand on your foot, you can stand on one leg and close your eyes and you should be able to stand still like this and nice and stable. If you're all over the place, then your shoe is not giving your feet the proper support. That imbalance is translating up and affecting the back. So what you can do is if your feet are bothering you, can grab a tennis ball and just kind of let it dig into the bottom of the foot in different areas that feel good. You can also go up and have it go on your calf, the back of your leg, in the back. You can do it in the front by laying on it like this. Just get creative. There's no right or wrong way of doing that. But sometimes that may release some adhesions there in the feet and make that feel better. But if not, then I recommend you find a doctor of chiropractic that specializes and knows how to adjust the specific bones in the feet. It can make a huge difference. When you get all the feet adjusted, all the ankles and the joints in the feet adjusted and moving properly, your feet like tingle and you're balanced, and it affects everything else up above. Also, it's good to get these checked. The lower part of the tibia and fibula where it attaches onto the talus and your knee, hip, and that can make a huge difference in back. So sometimes if somebody has a low back problem, you can adjust this till the cows come home, but if you don't correct the underlying foundation, you'll have consistent chronic low back pain. So I hope this video has been helpful, and this is Dr. Taylor signing off.
I've been dealing with chronic back pain for quite a while. I was referred to Dr. Taylor by my mother-in-law after it got really bad. I came to Dr. Taylor almost hobbling. It was in severe pain, and within a week, a little over a week maybe, I've noticed drastic improvements. Most recently, I received some orthopedic inserts for my shoes, and I was able to use those while I went to the botanical gardens over the weekend. And normally when I walk around all day, I'm in pretty severe pain at the end of it, where I'm taking a good amount of ibuprofen. I didn't need that at all over this weekend, and it was pretty eye-opening. The orthopedics helped immensely, and I think I've improved quite drastically. So thank you, Dr. Taylor, for all your help. Thank you for all the adjustments, and I'm doing much better.